Hi everyone! So first of all, thank you guys so much for asking those really interesting questions. So here we are answering all the questions related to a tennis elbow injury. So number one is how to train with tennis elbow injury. So tennis elbow injury, it could coming from different sources. It could be coming from repetitive motion of the wrist, and in sports very commonly it's coming actually from the laxity of the ligament inside of the elbow here. So we all know that when we standing straight, that the elbow should have a little bit of the curvature here. So normally this angle is between 10 to 15 degrees, and sometimes if we're doing sports that keep pushing our arm out, it could actually increase this angle and make the ligament here very loose, that make the elbow less stable. So what happened is that if the bigger muscle group are not actually holding the elbow in the right alignment, what happened is that our small muscle on the forearm here are going to start to try to compensate. And that's when they start to have the overuse injury and lead to tennis elbow. In order to protect our arms, so depending on the sources of the cause of the injury, there's different brace that we can use. If it's more coming from overuse and strain on the muscle, those one that is kind of like a half circle, has a foam compressing on it, it could help. But if the source of your injury is coming from that angle or the laxity at the elbow, then what we need to wear is more a sleeve that actually protects the alignment of the elbow. And if your injury itself is too severe, you're in too much pain, that the brace itself is not enough, then definitely you want to take some time off from your sports while working on all those elements. So for example, if your elbow here is very lax, then you definitely need to work on your core, the stability of your shoulder, and also the bigger muscle group, the tricep and the bicep in the correct alignment, so that eventually that this little muscle here would start to compensate and be overused a lot less. Now on to the second question. So the second question is, as a hairdresser who are more prone to have tennis elbow injury, what kind of exercise that we can do between clients to actually relax the muscle? So that's a very good question. So what happened is that during work, it involves a lot of repetitive motion of the forearm, and it's literally like doing a sport. If you use the muscle, you want to stretch it so the muscle can regain its optimal flexibility and length, so that when you're working on the second client, that your muscle would have already a normal optimal flexibility. So for the forearm, there's two stretching we could do. Number one is that you want to keep your arm straight, really make sure that your elbow is straight, and then you just bend your fingers towards you, and you use the opposite hand to pull the finger towards you and a little slightly towards the pinky. So what you want to feel is that you want to feel a nice stretch over here. And it's important to keep the elbow straight. It's just because this is a muscle that overlap to joint. It covers the elbow and also the wrist. So you want to be able to keep the elbow straight and also stretch that part of the muscle as well. So we'll hold it for 30 seconds and then repeat for 3 repetitions. If you're too busy, like between the client, even if you just do 1 repetition, that would help you to relax the muscle as well. The second one, we would keep the arm straight like this. So you're gonna have your palm facing the sky, and same thing, you pull your fingers towards you, and then you feel a nice stretch over here. We can hold it also for 30 seconds, 3 repetitions as well. And sometimes what could also causing the pain is that we have a lot of superficial nerve here, and it's a little bit like the funny bone on the other side, that it can get very tender and sensitive. So as we know that the nerve is actually the source is coming from the spine, our vertebral column. That's why it's important to also stretch our neck and our upper back a bit, because often when we're working, we're very often stay in this position. If you're working on a chair, what you could do is simply just sit all the way back, have both of your hands behind your head, and just lean back to nicely open up the upper back. Hold it there for 10 seconds and repeat that for 10 times. If you don't have time, just doing that 10 repetition would be very helpful as well. If ever your work is more standing, that you're not always access to a chair, there's also a way to stretch your spine in a standing position. So basically, we just need a wall. Ideally, a corner of a wall would be better. And you're just gonna put your arm like this. So elbow at 90 degrees, arm 90 degrees to the body, one leg in the front, one leg in the back. And then you just turn your body toward the opposite way to really stretch the shoulder, upper back as well. And then we can hold it also for 30 seconds and repeat for 3 times. And the second one would be keeping your arm a little bit more straight, diagonal, and then same thing. So that can help you to have the mobility in the spine to relieve the nerve down to the arm. And also it will help you to stretch out your shoulder as well. Because as the answer of the previous question, is that very often our elbow tends to be going in this position here, which is quite unstable because we're overstretching the ligament. Whereas if I have a nice flexibility of my shoulder, I'd be able to actually use my shoulder and open my shoulder rather than keep stressing this area here. So.
Okay, and for the last question, how to set up your work desk in order to not aggravate your injury of a tennis elbow. So this is actually very relevant because as you see from our previous post, tennis elbow actually clinically happens more often due to work and ergonomic and occupational type of movements rather than actually, as the name suggests, tennis or sports. And the reason for that is because when we're at work, we spend 8 hours a day doing generally repetitive tasks, whether you're on the computer or you're doing something on the factory line or you're a handyman and you're drilling and doing things with wrenches. You're doing that task over a span of 8 or more hours, and that creates a overload on the muscles of the elbow. Whereas sports, unless you're a professional, you tend to play maybe an hour a day. So, in terms of setting up the desk, one of the main things that we have to consider is how at rest our body is when we're in the seated position in front of a computer. So the most appropriate would be a computer desk setup, since most people are working on the computer. So how we need to set it up is, first of all, as is always suggested, you should have some sort of back support, whether a rolled up towel or a little lumbar roll, just to keep your back straighter, because if you are slouched, then everything above it is already going to be in a less optimal position. So in order to set up the computer and the keyboard, the two things that we have to look at the most is the mouse and the keyboard. And that's because we use those two with our arms. Now, for example, let's say this is our keyboard. If we keep it far from us, and let's say this would happen for a lot of people when they put papers in between the keyboard and the person that's using them, then that means you have to reach like this in order to type. Now you can imagine that with the arms raised, this is at risk of creating a shoulder overuse and injury, but it is also using the elbow and the wrist extensor muscles and the finger extensors. So by typing like this, you're actually using a lot more work on these muscles as opposed to like this, where it is mostly at rest and supported by the table. So the first hint would be to bring this closer to you so that when you're typing, all you're doing is lifting up your fingers. Since the common extensor tendon, which is the tendon that's usually inflamed with tennis elbow or lateral epicondylitis, it crosses over the wrist joint as well as the finger joints. So the more joints that need to work in order to contract the muscle, the greater the load on the elbow. By keeping this close and by having the palm supported, you're only lifting your distal fingers in order to type on the keyboard, so the load on the tendon is actually significantly reduced. Some people will also use one of those cushions that goes under the palm, so that when they're typing, their fingers are actually going from flexion to about neutral, instead of neutral to extension. Obviously, from neutral to extension, it's a harder contraction than from flexion to a little bit of neutral. So this would be the first thing that you can do to help with the tennis elbow pain. The second thing would be the mouse. Now the mouse, the same principle applies. You want to have the mouse close to you instead of far. So if this is the mouse, we want to have it nearby so that we can move our arm, our shoulder, as I'll show here. I'm moving my shoulder in order to move the mouse. Instead of, if it is here, you see you move your shoulder, but all these muscles are working while you're in this position. And then the same thing as when you're clicking, this is going to be a lot more work than this here. So you want to bring the mouse closer to you. If after having changed that, it still hasn't corrected the issue, it does exist some stand-up mouses. So instead of needing to click like this, the mouse, you actually hold like this and you click it from the side. By rotating the arm to the side, you're no longer putting the common extensor tendon as much under strain, since it is no longer against gravity. This is going to be a lot heavier than going like this. So you can always look into one of those mouses, the stand-up mouses, and that from personal experience and also from the reports of my patients, they said that it actually has helped them significantly to reduce the pain. So these are some of the main tips. Bring the keyboard closer to you, have the arm and elbow and as much as possible the wrist supported, so when you're typing it is a light load, and bring the mouse close to you. Use your shoulder to do the movement instead of using the wrist as well as the fingers, and if that still does not work, then you can use a stand-up mouse instead. So try that out. You can also look at the first and second questions, because there we explain to you all the stretches that can also be beneficial. So with the combination of these three answers, it should be able to help you have a better understanding of your injury and to also help you better manage it. And if ever you feel like with those little tricks it still hasn't worked, then for sure you should come see one of our physiotherapists or osteopaths, and we can definitely help guide you to determine exactly what the cause of the problem is, as well as what other strategies would be beneficial and treatment techniques would be beneficial to help you recover faster. Okay, so thanks again for all the questions. We're really enjoying the interaction with our patients, and this is going to help us be specific to give you the answers that you guys need. Thank you, and have a great